So good afternoon, and we're thrilled to be here today in Chelsea, where we just had a chance to tour the vaccination clinic at Colaborativa's headquarters, which is currently being operated in partnership with East Boston's Neighborhood Health Center. I want to thank Gladys and the team for hosting us, and to Manny and your team for all the work here at the health center that you're doing to make sure that we get people vaccinated as quickly as possible. And I also want to say thanks to City Manager Tom Ambrosino, who's been a terrific partner on so many issues. And I also want to say how much I know the Lieutenant Governor and the Secretary and the Senator appreciated the chance to tour the food pantry today with you, Gladys. That was quite an experience. Not one we will soon forget, I can promise you that. We're here today to talk about COVID and the work that's being done to support communities like Chelsea, helping residents get vaccinated and helping the community deal with and recover from the pandemic. I do want to give a quick update on COVID-19 cases, hospitalizations, and vaccinations. Yesterday, the Department of Public Health reported 2,252 new cases out of 115,453 tests. And I just want to say that while there's been a significant decline in daily testing nationally, the Massachusetts test counts have actually stayed pretty high. We were somewhere in the vicinity of 85 to 95,000 tests through the fall and through the beginning of this new year, and we're still clanging around somewhere in that general vicinity of 85,000 to 95,000. The national numbers have moved from around 1.8 million at the end of calendar 20, the beginning of calendar 21, to a number that looks more like about 1.1, 1.2 million a day. We think that's a good thing. We think testing is important. It's important for lots of reasons, but the biggest one is it helps us continue to identify positive cases so that we can then work with our local communities and our collaborative efforts around contact tracing to make sure that we help people isolate and get the support services they need to help stop the spread. Nearly 19 million tests in total have been conducted here in the Commonwealth. We currently have about 690 individuals in the hospital with COVID, and about 170 are in the ICU. We continue to monitor that data every day to continue to manage and adjust accordingly to deal with transmission and with COVID. Like many places around the country, we've seen an uptick in new cases, and as I mentioned earlier this week, the largest growth in new cases in our state is occurring in people under the age of 40. In fact, the numbers among those over the age of 70 have dropped dramatically since January, which is a really important sign with respect to the importance of the vaccine, given that at this point in time, more than 80% of the folks over the age of 75 in Massachusetts have been vaccinated, and more than 70% of the people over the age of 65 have been vaccinated. Worked really hard early on that vaccine rollout program to get there, and it's made a really big difference. And having so many of our seniors vaccinated at this point helps keep down both cases, but equally importantly, hospitalizations, and in many cases, death. Overall, we've administered about 2.3 million first doses, including the single-dose J&J vaccine, and over 1.3 individuals here in Massachusetts are fully vaccinated. We've been a national leader for the past several weeks, outperforming almost every state in the country, and we continue to rank number one among our peer states, the 24 states that have more than 5 million residents. We rank number 4 nationally in first doses administered, and we've been in the top 10 of all states for months now, something everyone here today should be immensely proud of. As we distribute vaccine across the Commonwealth, we continue to focus specifically on the 20 communities that have been hardest hit by this pandemic, communities like Chelsea. With a large population of essential workers and people of color, Chelsea's been disproportionately impacted by COVID-19, and we've been working with local officials and community organizations over the past year to respond to that. We've supported La Colaborativa and other organizations through our $65 million food security program. Lots of comments today about the truck. And we work together to help families keep food on the table. We've provided free asymptomatic COVID-19 testing through our Stop the Spread program. There are 4 testing sites in Chelsea, including one of our free Stop the Spread sites, which is run in partnership with Beth Israel Deaconess Medical Center. We've also worked with local officials and organizations to provide multilingual public health outreach and educational efforts here for residents. And just this past month, we worked with the local leaders to ensure that Chelsea got the support it deserved from the federal relief package. As many people know, the federal bill, as it was passed, had funding restrictions that severely limited the dollars that would have gone to some communities in Massachusetts that were hardest hit by COVID, including Chelsea and Everett, both of which are in Senator DiDomenico's district. So it probably shouldn't come as much surprise that the first person I heard from at the state level, after having conversations with folks at the federal level, was Senator DiDomenico. And we very much appreciate the relationship, but also the heads up with respect to that issue. We work directly with local officials, including folks like City Manager Tom Ambrosino, to ensure that these communities would have access to appropriate funding levels to support their needs. And last week we announced that we would direct an additional $100 million to Chelsea, Everett, Methuen, and Randolph after our conversations with these communities. These communities will be able to use that $100 million in direct aid to support costs related to the COVID-19 pandemic, including direct response efforts addressing negative economic impacts, replacing revenue that's been lost during the pandemic, making investments in water, sewer, and broadband infrastructure, as well as many other eligible expenditures. As we look ahead to the rest of the vaccine rollout, we're committed to ensuring that communities like Chelsea get the support that they need so that people here can get vaccinated. Earlier this week, we visited the Hines Veterans Convention Center to highlight our new partnership with FEMA that designates the Hines as a federal mass vaccination site, which will bring 6,000 additional daily doses to Massachusetts. And even though the site's in downtown Boston, the new partnership is good news for the region because our collaboration with the feds allows us to create a hub-and-spoke model, which allows a portion of the doses that we get from that central hub to be distributed to nearby communities through mobile vaccination units and pop-up clinics with a focus on vaccine equity. So starting next week, we'll be working with municipalities to launch mobile vaccination efforts in Chelsea, Revere, Boston, Fall River, and New Bedford. And like the Hines Convention Center and other federally supported sites around the country, these cities were selected based on the CDC's Special Vulnerability Index and their proximity to the Hines. These mobile efforts will ramp up over time, but we'll get up to doing 500 vaccines per day in each of these communities. Doses will be picked up by the mobile vaccination teams at the Hines and then distributed and administered in these communities. Most of these mobile units and pop-up clinics will set up in city parks, parking lots, and other places that are easy to access for community members. And the program will also include grassroots efforts in each community to raise awareness about these mobile clinics and assist in booking appointments. The mobile vaccination program will kick off, as I said before, next week, and the program, like the broader program with FEMA, will run for about 8 weeks. The mobile programs, in addition to the homebound vaccination effort that we launched last week, and will specifically focus on people who can't leave their homes to access the vaccine. We're also investing over $20 million across the 20 hardest hit communities in Massachusetts to reduce barriers to vaccination and promote equity in vaccine distribution, and that includes a mix of state funding and federal funding, which we recently received from the CDC. Today, we're glad to announce details for how some of those funds are going to be spent. The Department of Public Health is awarding $4.7 million directly to municipal governments and local boards of health in each of those 20 prioritized communities. These grants will support staffing and public health infrastructure, along with efforts to coordinate vaccine clinics and promote vaccine trust and confidence. Chelsea is set to receive about $150,000 from this grant, and we look forward to awarding more out of the $30 million equity program in the next few weeks. Secretary Sutters will share more details on this grant in a moment, as well as details around some of our door-to-door efforts in many of these communities to promote access and awareness to vaccine. Before I close, I want to offer some quick thoughts about staying safe over the course of the next few days. Obviously, Passover started last weekend, and Easter's coming up this weekend. We know these holidays are very important to people, and they're a very significant opportunity for folks to gather with family and friends. I know people have heard me say this before when it comes to celebrations of all kinds. These celebrations, in many respects, really do need to look a little different this year than they have in past years, but I would say just this year. Be great if people could continue to celebrate with their immediate household. If you spend time, any length of time, with other people, we urge you to wear masks and to maintain a certain amount of distance. Don't share drink or food. And if you do have a small celebration and the weather holds, consider holding it outside. If you can't celebrate outside, crack open the windows and make sure there's ventilation flow across the rooms you're all congregated in. And you don't have to crack them very far. If you literally crack the windows about this much, you'll get the 4 to 5 times an hour airflow that people talk about as being critical to supporting you in those situations. And when you do gather with your family and your close friends, we please ask you not to drop your guard. The virus, as we know from previous holidays, has a particular opportunity to spread in those environments. We saw it happen at Thanksgiving. We saw it happen at Christmas. Let's try and make this particular weekend a little different than what we saw at the previous two. We know we have an opportunity here with vaccines to continue to put 50 to 60,000 shots in arms here in Massachusetts every single day. And it's going to be an effort that we believe can ultimately be successful, which will give us all an opportunity to get back to what we think of as the normal that we left behind. But I can't tell you how important it is for people to continue to be vigilant, especially as we move toward the warmer months here in Massachusetts, and to do all you possibly can to recognize that we have made progress, you have made progress, but we still have work to do, especially with the new variants that are on the ground here in Massachusetts, elsewhere in this country, and around the globe. And with that, I will turn it over to Secretary Sudders.
Good afternoon, Governor, Lieutenant Governor, Manager Ambrosino. Always good to be with you, wherever you are. Gladys, thank you for hosting us today. Manny, it's always good to be with you and with your folks who are doing vaccines. Today I'll be giving some more detail on the ramp up of outreach in our equity communities starting next week, detail a little bit about the $4.7 million Best Value Grant Awards, and highlight additional PEBT support for families across the Commonwealth. Archipelago Strategies Group, which is a certified minority woman-owned business, and Healthcare for All have been working closely with the Department of Public Health and our equity communities to build a robust outreach program tailored to meet the needs of each community. Starting next week, over 200 bilingual, locally hired community organizers will hold 83 outreach events in neighborhoods across each of our 20 equity communities for business walks and door-to-door canvassing. It's like a political campaign, except it's vaccine canvassing. And we'll also start phone banking efforts to support vaccine appointment registrations. The Best Value Grant funding is meant to put funding directly into the hands of these communities. You don't often hear us use the term Best Value Grant. So what that means is literally a direct grant to the city without formal application and the like. For Chelsea, as you heard the governor said, this means just about $150,000 for the city to support vaccine initiatives as you determine what is needed best. The funding is from today through June 30th. These resources are essential to getting folks vaccinated, to deal with vaccine hesitancy, and we have other key resources necessary to support our vulnerable communities and populations. Community grassroots organizations like Colaborativa have kept our disproportionately impacted communities going throughout this pandemic. Their communities look to them for guidance, strength, truth, and support. And having just toured the food pantry down the street, you have delivered. But I want to be really clear to everyone here, it is not a food pantry. La Colaborativa is true to its word. It's about community. The food pantry is just a way to open the door to individuals and meet whatever it is they need for food, housing, support, education, filling out applications, whatever it is truly wraparound. And I'm sure you will describe that much more eloquently than I did. In the fall, La Colaborativa received about $58,000 through our COVID-19 community grants to ensure that you could continue lifting up your community. So I can't tell you how much you're going to get next week, but next week that grant will be continued. The Department of Public Health did not want me to take their thunder, but I assure you it will be continued as of next week. Additionally, Chelsea has received over $1.5 million in funding for food security and to combat hunger in their community during the pandemic, in addition to the food truck for you. Finally, I just want to mention about PEBT, because we know food insecurity and getting money into the hands of families is so important. Massachusetts was the third state in the country to receive federal approval to expand pandemic EBT, known as PEBT, to an estimated 96,000 children under 6 on SNAP, and to increase all SNAP benefits by 15%. I know this is something very important to Senator DiDomenico. PEBT was created by the federal government to supplement food budgets for children who normally receive free and reduced price lunch at school. The approval of our plan to expand PEBT to families with young children support our youngest residents, for whom access to nutritious food is vital for healthy growth and development. On March 25th, eligible households received $136 in PEBT benefits for the month of February on their SNAP cards. To date, we have helped more than 550,000 students and their families buy food, bringing over $396 million of additional federal dollars into the state to support in food purchasing power. With in-person learning returning in Massachusetts, it's possible that the benefits will be reduced. However, children are still eligible for SNAP, WIC, and other nutrition supports, and we encourage them to apply, and we will work with you closely to make sure that happens. And I just want to echo the governor's remarks about Easter and Passover weekend. Please, if you do celebrate responsibly, safely, and smallly, if that's a word. It's important to continue to wear a face covering, limit your interactions with your closest, and engage in physical distancing. And please get tested if you feel sick or think you've been exposed to COVID. Testing is free, widely available, with over 400 testing sites across the Commonwealth. And we are adding additional free testing sites in our equity communities. Finally, a housekeeping item. Due to the end of Passover and this weekend being Easter Sunday, there will be no daily COVID-19 dashboard posted Sunday, April 4th. The Sunday data will be posted the following day, Monday, April 5th, and that report will include 2 days' worth of data. Remember, practice your bubble fidelity this weekend and be safe. And now it is truly a privilege to turn the microphone over to Gladys Vega.
Thank you so much. So I am Gladys Vega. Many of you know me. I'm the Executive Director of La Colaborativa. Es un placer estar aquí. Le digo, es un placer tener a nuestro gobernador en nuestra casa, en la ciudad de Chelsea, una ciudad tan y tan necesitada, que fue el centro épico de la pandemia. Les quiero decir en español bien breve a toda la gente que nos está viendo, sabemos que vamos a celebrar un holiday de Pascua, pero si ustedes no se cuidan, esta parte de nuestra vida nunca va a cambiar. So, queremos que ustedes continúen cubriéndose, poniéndose, haciendo todo lo posible por hacer los exámenes para los síntomas del COVID, y además a la comunidad más joven, a los de 35 a 20 años, por favor vacúnense. Si nosotros queremos una normalidad, tenemos que vacunarnos. So this is Gladys Vega, and my message in terms of the Latino community, I ask that we do not stop doing the testing, that we do it as much as we can, and that during this holiday that is coming, I ask those people that are in the ages of 35 and 20 to please make a decision on vaccinating. As we've been doing door knocking, that has been our biggest challenge in convincing individuals that are 35 and under. They don't believe in the vaccination, but they love to party and have gatherings, right? So I urge you to please make the right choice. And if you're not able to make that choice for you, make it for that family member, for that grandmother that wants to give you a hug. But make sure that you do it for the sake of others. This is not a joke. You have seen the numbers. You have seen how much families have lost loved ones. And we want to be able to make sure that everyone in the city of Chelsea and surrounding cities and the state of Massachusetts get vaccinated. And in terms of the governor being here, for me, it's a dream come true. It's incredible that we have his whole team here today, but also it's more incredible that he responded to the call of the funding. So for me, I was extremely appalled that we didn't get as much funding 2 weeks ago. And when we called the governor's office and we organized, you responded to our call. If you take a look at those sheets over there, we had the youth and staff going through the power of the government and explaining how if the federal governor fails, where do we go? And that was you were the target. So that's what we did with the youth and parents when we brought them here as we were getting together. But I have to tell you that you responded. People kept saying, you're not going to hear from the governor's office probably within like a month from now, a month and a half. And within days, we got the news that you were going to fund our city. I will also be remiss if I don't acknowledge all the work, Senator Saldi Domenico, that you did for Chelsea, and not only for Chelsea, because when we advocated, we didn't leave the other 3 cities behind. We did Randall, Brockton, was it? Methuen and Everett. I mean, those are the 4 cities that didn't get enough funding. And now we would use this funding for anything that our Tom Ambrosino and the City Council says that we need to use it. But it's an incredible day for Chelsea. It's extremely hopeful just because we're able to continue to get the work with additional resources. And once again, para las personas que me están escuchando, vacúnense. Es tan simple como eso. No tengamos miedo a la vacuna, téngale miedo al coronavirus que mata. Y eso es lo importante. Tenemos que vacunarnos. So once again, for the people that are here, that are seeing us, please vaccinate. You know, don't be afraid of the vaccination. Be afraid of COVID-19 that has taken so many lives away from us. Gracias. Thank you.
Always a challenge to go after my dear friend Gladys Vega. Thank you, Governor. Thank you, Lieutenant Governor. Thank you, Secretary Sutters. Thank you, Tom Ambrosino. And thank you, Senator DiDomenico. My name is Manny Lopes. I'm the President and CEO of East Boston Neighborhood Health Center. Again, I want to thank Gladys Vega and the entire La Colaborativa team for allowing us to utilize their space to vaccinate Chelsea residents. This site, or the site that we're here today, serves as a trusted local option for Chelsea residents to get vaccinated. Another example of bringing solutions closest to the problem in neighborhoods hit hardest by the pandemic. This site acts as a community-based spoke to complement the largest hub sites across the state. That hub and spoke model, Governor, I think I trademarked it, so we need to talk. But it's exactly what the governor's vision in terms of how he's created the efforts of getting as many people vaccinated as quickly as possible here in this state. At the Health Center, we serve over 40% of Chelsea residents and have formed deep ties with local organizations like La Colaborativa. Our staff speaks the languages, knows the challenges, and are also viewed as trusted partners within this community. For these reasons, we like to say that our sites are built by the community for the community. Today, our sites in Chelsea, East Boston, Revere, and the South End have administered over 30,000 COVID vaccines to date, over 30,000. Here in Chelsea, we continue to double our efforts with educational sessions for residents, pop-up vaccine sites for large employers, and we partnered recently with the City of Chelsea to vaccinate teachers and homebound individuals. We are truly taking the fight to the front lines. This multi-pronged approach is focused on removing barriers and creating an equitable vaccine experience from start to finish. And today, I'm happy to announce that we will be expanding our capacity here at this location as well as in all of our locations. We will begin operating 7 days a week and in some of our locations 12 hours a day. Although we're acting as fast as we can, I'd like to take this opportunity to preach patience. Everyone has their own vaccine journey. For some, it will take time, especially in communities like Chelsea, where inequities and distrust are widespread. Vaccination in Chelsea is not just about yes or no, it's about the facts. It's about feelings, it's about frustration, it's about family, it's about finances, and of course, as we know, it's about fear. Addressing these barriers is the work we have ahead of us. So let's continue to fight together. We're excited to continue our partnerships with community-based organizations like La Colaborativa, our local and state and federal government, as we all work towards the common goal. And finally, as we look down this long road of recovery, I have no doubt in my mind, if any city can do it, it's a city like Chelsea. Thank you again, Governor, for being here and being with us and being a dear friend. Really appreciate it. Now I'd like to welcome City Manager Tom Ambrosino.
So thanks, Manny. I just will briefly conclude by expressing on behalf of the City of Chelsea our thanks to Governor Baker, Lieutenant Governor Polito, Secretary Sutters, not just for coming here to Chelsea today, but for all of the help you've given the city over the course of the last year of this pandemic. Most recently, of course, with the problem with funding in the ARPA formula, but that really was just the most recent of circumstances where the governor and his staff and his secretaries have been so helpful to us. I don't have to tell any of you about the great challenges we faced in Chelsea over this past year, but at every step of the way, when we've reached out, and we've reached out a lot, the governor and his team, his secretariats, particularly Secretary Sutters, have been really extremely helpful to the city of Chelsea. So on behalf of the city, I just want to express our gratitude for all you've done for us, and hopefully this pandemic is coming to a close soon. So thank you.
Governor, you say a lot of the cases lately are in people under the age of 40. A lot of other states...
More like
are
50, but yeah.
Under 50, okay. Still not eligible on Monday. A lot of other states are fast-tracking the vaccine timeline. We're getting more doses. Will you?
I think our timeline is consistent with the recommendations that were made by our advisory group. And I can't continue to stress that our focus from the beginning of this has been on those most vulnerable. And I think in many respects, that's where it should be. By having everyone eligible by Patriots' Day, April 19th, we will have given the most vulnerable among us in Massachusetts the opportunity that they need to get vaccinated. And we've had tremendous success so far with this rollout in getting big chunks of the population associated with each of these categories vaccinated before we moved on to the next one. You know, people tell me all the time that there are other states that have broader eligibility standards than we do. Every single one of those states that people have raised with me that was a significantly sized state has vaccinated fewer people as a percent of their population fully, fewer people in terms of their first dose, and typically in most cases have not put as much of the vaccine that's been made available to them to work as we have. Eligibility is one thing. actually executing on the ground and getting big portions of the populations that are eligible vaccinated is another. And I think the way we've set this up has been the appropriate way, with a lot of great guidance from a lot of people on that advisory board from the beginning.
Sounds like the 100,000 doses of Johnson & Johnson vaccine we talked about yesterday, it sounds like that's not part of this federal mix-up right now. Yeah, good news,
Right.
Good news.
Yeah.
Big deal. So can you tell us where these doses will go? Where you envision them going?
Do you want to speak to this? I think the answer is going to be everywhere, but there are several.
You can say that at the microphone.
Look.
Both of you.
I mean, remember, there's two channels this is going to travel through. About half of them are going to go through the retail pharmacy channel, which means they will sort of be in addition to what many of the CVS and Walgreens folks have been doing on a single-shot basis so far. In some cases, CVS and Walgreens have opened up sites that aren't normally open to do the one-shot thing, just to get it done. Given the size of this, I don't know if that's going to be the strategy they use or not. Have they told us how they plan to do it yet?
The retail pharmacy?
Yeah.
The CVS and Walgreens are going to do basically sort of open up about 20, 30 stores.
Yeah, right. I mean,
And then they'll close them.
so they'll, yeah.
So the great news is the governor says the 100,000 for next week is not in jeopardy. Thank you. And we're going to use it in a number, we're going to basically take most of our non-mass vac sites and sort of give them, distribute across regional collaboratives, community health centers, our homebound program, low-income senior housing, and literally take the 100,000 and just across most of our supply chains, with the exception of the mass vac sites.
Can you tell us why? Why are you choosing to go that route?
So this is a one-time bolus. So it's unclear. So as the governor said, we know we're going to this 100,000, but then the J&J for us going forward the next few weeks is sort of under review right now. So we don't know if that's part of what's been the manufacturing issue. So if you have just a one-time bolus, instead of starting a new program, the best way to utilize this is, as the governor said, I mean, we're very good now at distribution to allocation to administration, is to take our existing channels and pump it out. So we can get 100,000 potential doses out next week, and that's 100,000. So J&J is one and done. So that'd be 100,000 people newly vaccinated, fully vaccinated in the Commonwealth.
Is there a danger with what happened yesterday, the news out of Baltimore, 15 million doses nationwide in trouble or not good? Next week's all set here. You're sure of those. But how about the weeks after that? Is there a concern that you're going to have a drop-off?
So for us with J&J, we have not had, for the state's distribution, a steady supply of J&J. We had like 7,000 one week, 9,000 another week, and then, had this wonderful news of 100,000 for next week. And the federal government has indicated that the next few weeks' doses is under review, and we will have more information about that next week. But this, again, 100,000 first fully vaccinated individuals is a great opportunity and challenge to have to push it out next week.
Governor, I have a question in terms of, obviously, these equity efforts, a lot of folks would argue are long overdue, right? But there's increasing data that shows that white Republican males are the ones that are the largest population that are hesitant to get the vaccine. So as we focus on this equity piece, is there a plan for outreach to that community?
Keep in mind that most of the folks in almost all the survey data that's been done who are hesitant are not never. They're just not now. And I think for many of those audiences, some of the commentary that was offered by both Gladys and Manny speaks to the fact that a lot of folks in communities of color have a lot of very good reasons to be hesitant about this and to take a wait-and-see attitude to it. And I think organizations like East Boston Neighborhood Health Center and La Colaborativa, are the kinds of organizations that are going to help move this. And when we were down in Brockton, talking to the folks at Brockton Community Health Center, which has actually done a terrific job with this stuff so far, they made clear that they are getting folks who were hesitant to start coming in. And I do think the door knocking that Gladys's folks are going to be doing, the resources we're going to make available to those 20 communities that they can figure out how to move the needle forward will make a difference. I think the door knocking and the campaigning that Archipelago and Healthcare for All are going to be doing, both organizations that know these communities really well, will help. I think when it comes to other parts of our Commonwealth, Republican white men, I think for them it's going to be the same game. It's going to be because their neighbor got it, or their coworkers got it, or their doctor reaches out to them and says, you really need to get vaccinated. It's going to be that sort of message that's going to move them. But the way we're thinking about this at this point is there are 1 million people who have pre-registered in Massachusetts to get vaccinated, okay? And we haven't had any trouble with our regional collaboratives filling every single slot they have. And even as CVS and Walgreens have significantly expanded their capacity, as the feds have put a lot of vaccine into that channel, every single appointment gets booked. So there is tremendous demand among those who want to get vaccinated here in the Commonwealth. We have tons of work to do in those 20 disproportionately affected communities that we should do to try to encourage and pull people in, and to get to people who may not be able to get to a vaccination site on their own, even one that's centrally located like this. One of the things Secretary Sutter said we're going to do with some of this J&J, because it's one and done, is go to community centers and senior centers and pump some of this to the mobility program, because you don't need to come back and schedule a second dose for a lot of those folks. But I think for a bunch of people, there's a hesitancy, and it's different reasons for different people. And part of this, the more people you get vaccinated, the more familiar people become with other people who've been vaccinated, the more likely you'll be to get folks here vaccinated, but also to get some of the white populations that are hesitant to get vaccinated as well.
Governor, given the fact that people are hesitant, and the fact that somebody messed up the recipe for Johnson & Johnson in Maryland, are you concerned that people will go show up, you get J&J, and they won't trust it?
You know, I would hope, I mean, the message I take from this is actually the opposite, which is people screwed up, people recognized, people ditched it, right? I mean, the message to me is whatever the control process was that was in place there, it worked. Those vaccines didn't get distributed. It's a shame to have 15 million vaccines when you're in a race against variants go down the drain. But the good news is the control process worked. They realized they had a problem, and they didn't ship any of them. The overall real-world experience we've had so far with all 3 vaccines in Massachusetts is borne out by the experience we've had since we started vaccinating people in December. I mean, we have less than 1,000 people over the age of 70 showing up on our daily dashboard as positive. Less than 1,000. I mean, that number used to be multiple thousands across every single quintile of the population in that group. And that number continues to go down for the over 60 population as well as they get vaccinated. I mean, the proof on the quality or the performance of the vaccine in Massachusetts, I think, is pretty evident at this point that it works.
Governor, any plans at this point?
I love your line, by the way, Gladys. Don't be afraid of the vaccine. Be afraid of COVID.
Any plans at this point? Yesterday, Pfizer said that the vaccine was safe for 16 and under. Plans to vaccinate 16 and under school children?
I think we're going to wait and hear what kind of guidance we get from the federal government on this issue. Look, I think the fact that that kind of clinical trial is going on, not just here, but in other places, is a really good thing, because people are going to want to start to know once we get through the 18 and up population, 16 and up population, how are we going to deal with younger folks, and having clinical trials there is a good thing. But that's a perfect example of something where, you know, firms run the trials. They seem to promote the positive results more quickly and loudly than they promote the results that aren't so positive. And my view is we should wait and hear what the feds have to say about
Governor,
this.
what about type 1 diabetes? Will you consider adding them to the list before April 5th when the one medical condition people are eligible?
Is April 5th like Monday?
Yeah.
Before Monday? I mean, we can talk to the advisory board about that. But generally speaking, the biggest change we made relative, and they made relative to the CDC recommendations was around asthma, and that was specifically to deal with the environmental justice issues associated with asthma, especially in communities like this one.
But they added type 1 diabetes, so I'm just wondering, when are you going to align with that guidance or not?
We haven't aligned with all of their guidance from the beginning.
Governor, are there any plans to scrap front mod at all?
We've talked to many of the regional collaboratives about whether they want to be part of the pre-registration program. And I think in the month of April, you will see some of them come in. But we've said to them that this is their call. So it's going to depend to some extent on whether they want to be part of the pre-registration system or continue to operate on that platform.
Governor Ambrosino and Manny Lopes, now we're here. A lot of critics have criticized the state and the governor on the rollout in terms of the communities of color. You guys you're from Chelsea, obviously the hardest hit. You're working in the community. What's your response to those folks that say that this administration has not been responsive to doing this? We want to hear from you guys. Yeah.
Look, I can just speak from the Chelsea perspective and say that we have gotten tremendous support from Secretary Sutters in terms of getting vaccination to our residents here in Chelsea, including most recently this push to do mobile vaccines. In addition, the administration was particularly helpful to East Boston Neighborhood Health Center in terms of getting them to the kind of support they needed to open a clinic right here in downtown Chelsea. I mean, we've been vaccinating people in our downtown for almost a month now. So I would say that my experience in this city has been that the administration has worked extremely hard to ensure that we have adequate sites and adequate vaccine.
Thanks, Tom. And I would just add that this site could not be possible without the partnership and the support from the state and the governor and the secretary. When we were setting up our sites, this was the first phone call that I made, told them about our plans, and they said anything we can do to help, including sending the National Guard into East Boston and as well as Revere, which helped bring some of our staff over here to Chelsea. So I would say look at the data. Just recently looking at, as the governor mentioned, the population, the first group that was eligible, we know were the healthcare workers. Second group was 75 plus. We vaccinated in Chelsea over 80% of the 75 plus and over 70% of the 65 plus. So again, look at the data. Definitely hesitancy, but in terms of supply of vaccines, staffing, and space, my 3 S's that I've always talked about, the state has really helped us.
Governor, question about MCAS. It looks like that Commissioner Riley has recommended that MCAS will be waived for 11th graders. Any response on that?
Almost all the issues associated with figuring out where kids are, given all the issues associated with school, both last spring and this year, is a challenging one. I think what I would say is the Lieutenant Governor and I have spent a lot of time talking to the Commissioner and his team about this, and some of it's about logistics, some of it's about time, some of it's about alternative strategies to figure out where kids are. I think the Commissioner is making what I would describe as a tiered approach to dealing generally with MCAS and with assessments overall. But I absolutely believe that with the federal resources that have been made available to local communities and to the Commonwealth, we have to have a really robust summer school program for kids. And if we don't have one, shame on us, because by that point in time, the vast majority of the population that wants to get vaccinated will be vaccinated, and probably a bunch of the folks who are now hesitant will also be vaccinated. And we really need to make sure that we do all we can for kids to ensure that by the time they get back to school in the fall, or by the time they go off to college or whatever it might be, that we've given them a significant opportunity to catch up on all that's been lost.
After the 100,000 doses from J&J next week, are you expecting more after that, or that's still the open question?
That's the big open question at this point. We don't know at this point in time what the next round. I mean, the J&J stuff, generally speaking, has been lumpier than the Pfizer and the Moderna. I mean, Pfizer and Moderna at this point are pretty much running. You know, we're getting what we got every week plus a little more. Pretty much, that's been that way now for over a month. But the J&J stuff has been lumpy. We were really excited about the fact that after, you know, a bunch of weeks of hearing that it was coming, there was finally this really significant move upward on J&J, which with the one dose creates a lot of opportunity. But we don't know we know what's next week, but we don't know what's happening after that.
Does what happened to the 15 million impact that, do you believe, make it even more uncertain?
I don't know, because they manufacture in 4 or 5 different locations, and I don't know, we don't know yet. I'm assuming we'll find out sometime next week what the impact of that was, or even what the denominator is in terms of how much vaccine they're actually producing at this point.
Thanks, guys.
Could you or Director Vega speak to whether any of the hesitancy comes from fears related to some of the public charge rules that have existed, and what efforts have been made to sort of address the chilling effect that could deter people from getting help?
Boy, I mean, the public charge thing's been repealed, right? So at a minimum, no, why don't you speak to that, Gladys?
Yeah.
By the way, can you answer that one in English and Spanish, please?
Okay. So in terms of the public charge rule, so immigration issues always plays a role, especially in communities of color and communities like Chelsea. But we have done everything possible to address those issues, to say that public charge has not been implemented at all. And please do not make that an excuse to not get vaccinated. We make sure, and we tell them all the time, listen, if we're behind the vaccination, it's because we're asking you to trust the government, this government of Massachusetts, make sure that you get vaccinated, because we haven't heard any cases that refer anyone for immigration because they're seeking vaccination or because they're sharing information. So para las personas que tienen una preocupación sobre el público, la contabilidad pública, por favor, no presten atención a eso. Una vez más, esto no tiene nada que ver con inmigración. Las vacunas son importantísimas para salvar vidas, pero aquí no hay inmigración. En el gobierno de Massachusetts no ha corrido un rol con nada que tiene que ver COVID-19 o con nada que tiene que ver con las vacunas. So, queremos que las personas se vacunen. Inmigración aquí no hay nada que ha indicado a nosotros que se está compartiendo cualquier tipo de información. Gracias.
Thanks, everyone.
We really gotta go. We're late. Thank you. Thanks for coming. Gladys?
Gladys.
Gladys.